Well, we have seen the numbers being reflected in the last few days, over the last week, really, as the backlog was going through. So I don't actually think that it's very challenging with something that you can't see and that many people have mild symptoms to reflect the challenges and the difficulties with this disease. So it is spreading in our communities. We know that. We know it's spreading in communities around the province, and that's why it's so important for all of us to take these measures. The testing that we're doing is actually fairly widespread. We're doing thousands of tests a day, and we are showing a number of positives every day. And the testing is really focused on the areas of highest risk. So we're focusing on healthcare workers and long-term care homes, on hospitals, making sure that we're catching those. But there's also quite a lot of effort going into catching clusters that aren't related to travel in our community. And we continue to do the baseline testing of influenza surveillance that we started a number of weeks ago. So I am confident that we have a sense of what is happening in our communities, but it's hard to get that message out. And yes, we know there are hundreds of people who have returned from travel who are at risk of developing this disease. And that's why it's so important that they self-isolate for those 14 days. And many of them will have mild symptoms, and they may transmit this disease even with mild symptoms. So I can't stress enough how important it is to have those physical distancing measures to stop us coming together and congregating and passing this on as a way to slow this down and slow the transmission down in our communities.
And just to add, that's where we're concerned. We're obviously concerned about long-term care, and that means we're concerned about our healthcare workers in the times they're in the community and in the times they're in long-term care, and this is what we owe to them as well. And it's been commented that some of these terms, the terms distancing and so on, are new terms. Stay apart. Stay at least 2 meters apart. Stay, if you're in the imperial system, 6 feet apart. Stay apart when you're outside. It doesn't mean you can't go outside. In other, such as California, people are allowed to go outside, but what is essential is to maintain that distancing. That's where it becomes important. But if you've seen the measures that have been taken with respect to long-term care, you know that we're very, very concerned about those who are vulnerable. Today, Dr. Henry announced 94 people whose COVID-19 has resolved, and that I think the total is now 100 cases. So for people who have mild cases of COVID-19 and follow the rules and stay isolated, and then they get better, that shows that's one group of people, but the group of people we're obviously concerned about every day, and who everyone should be concerned about every day, is particularly our elders and those with other vulnerabilities, be they chronic disease or others who are vulnerable in our communities. We have to think about them and act for them every single day, and that's why we need 100% compliance. And the most important thing, one we've said since the first press briefing in January, is if you're sick, stay home. If you're sick, stay home. We need people who are well to do essential jobs, such as working at Save On Foods and so on. They're essential jobs, and we need them to do that. But if you're sick, no matter who you are, you have to stay home. And that is the most important lesson for all of this. That's what makes all of this enormous effort, the massive ramp up in testing we've done here, all of the work that's being done in the healthcare system, the virtual supports we put in place, all of this is made worthwhile when people follow these simple orders from the provincial health officer.